Hello, I'm Master Firefighter Ned Lowry. Have you ever wondered about sleep apnea? This month's safety segment deals with sleep apnea and how it affects you at the fire station and your personal life. Join us now as we visit Norfolk's EVMS Sleep Medicine Center.
Obstructive sleep apnea is a very common syndrome, probably afflicts roughly 25 million Americans. And what it is, it's a syndrome in which there are repeated either high-grade or literally complete occlusions of your upper airway during your sleep. What happens when you have repeated occlusions of the upper airway is that, number one, sleep becomes very fragmented and less restorative, but number two, you can have repeated drops in oxygen level, and those drops in oxygen level can be problematic for your cardiovascular system. The symptoms of obstructive sleep apnea are numerous, but there are several that I think are important for patients and physicians alike to know. First of all, most patients who have sleep apnea have snored for quite some time. Snoring can be loud, but there's not a one-to-one correspondence between the intensity of snoring and how significant sleep apnea may be. Patients' bed partners or spouses may observe choking, gasping, or even pauses in breathing during the patient's sleep. Patients may also note nighttime sweats, nocturnal urination, and they often note less restorative sleep, and they're tired or sleepy during the day. In addition, patients with sleep apnea may have problems with memory, with cognitive capabilities, and with their mood. I'd like to talk about several risk factors, if you will, that I, as a sleep specialist, consider when I'm looking at a patient for possible obstructive sleep apnea. The first thing is being male. Males have roughly a 2 times greater likelihood of obstructive sleep apnea than do women. Now, I think it's important to recognize that women can also have sleep apnea. Premenopausally, women are relatively protected from sleep apnea unless they're obese or they have some sort of craniofacial abnormality. But I think it's also important for patients to know that after menopause, women are just about as likely to have obstructive sleep apnea as are men. And women can be slender and have sleep apnea after menopause. It's also important to recognize that age increases our likelihood of sleep apnea. So the older we are, the more likely we are to have obstructive sleep apnea. Last but not least of the big three, if you will, is obesity. The more obese we are, the more likely we are to have sleep apnea, and the more likely we are to have significant sleep apnea. When we see a patient that we suspect has sleep apnea, we need to do a physical examination, and there are several important potential findings. First of all, it's important to note whether the patient is or is not obese. Obesity does increase the likelihood of sleep apnea, and frankly, the more obese one is, the more likely you are not only to have sleep apnea, but to have more significant sleep apnea. We also look at blood pressure. Just under 40% of patients who have high blood pressure will have sleep apnea. And if you have treatment-resistant hypertension, which means you have high blood pressure despite the regular use of at least 3 blood pressure pills, you likely have a 70 to 80% chance of obstructive sleep apnea. But there are other things that we can look for on the physical examination. We look at the mouth very carefully. We look to see if a patient has a large tongue, if they have a high-arched hard palate, and if it's very difficult to see the uvula or other structures in the back of the mouth that suggest a crowded upper airway. It's interesting, but the bigger your neck, the more likely you are to have sleep apnea. So a woman who has a neck circumference of 16 inches or greater, or a man who has a neck circumference of 17 inches or greater, is more likely to have sleep apnea. Sleep apnea syndrome is important for a number of reasons. First of all, there are neurocognitive consequences. Patients may have problems with mood and with their memory. Patients don't function as well in a number of important activities. They may not be as effective at work, and they certainly are not as safe drivers. The data suggests that untreated sleep apnea patients are probably at least as likely to have, are probably 2 or 3 times more likely to have a car crash than are patients who don't have sleep apnea. But there are also a host of other physical consequences of sleep apnea. High blood pressure, diabetes, stroke, heart attack, congestive heart failure, sudden death have all been linked to sleep apnea. The way we establish a diagnosis is by first sitting down with the patient and taking a good history and performing our physical examination. After that, what we will do is some form of either in-lab or home sleep apnea testing. Until recently, almost exclusively, we would perform in-lab polysomnography or sleep study testing. And what that really means is that the patient would come into the Sleep Disorder Center on an outpatient basis. We would spend roughly 45 minutes putting a number of sensors on their body, but no needles, and we would record their sleep for 8 hours in the Sleep Disorder Center. And what we could do is determine the number of pauses or partial pauses per hour in their breathing while they slept. Our definition for sleep apnea being 5 or more pauses or partial pauses per hour in one's sleep. Now, there are also home sleep apnea tests. These are less expensive and able to be performed, as you might suggest, in the home. And so in patients where we think there's a high likelihood of significant sleep apnea, but no significant heart disease, lung disease, neurological disease, we can often have the patient perform a sleep apnea test in the comfort of their own home. The diagnosis is established the same way in that we're looking at the number of pauses or partial pauses in breathing per hour. The testing is the polysomnography or the home sleep apnea test that we utilize. The interpretation is done by a sleep-boarded specialist. And so what we do is we interpret the raw data and the scoring that's done by a sleep technologist. And if a patient has 5 or more pauses or partial pauses per hour in their breathing while they sleep, we determine that they have sleep apnea. Now, it's not a perfect metric, but the metric we use for deciding not only the presence of sleep apnea, but the severity of sleep apnea is the number of pauses or partial pauses per hour in your breathing while you sleep. So if you have 5 to 14 pauses per hour in your breathing while you sleep, that's mild apnea. If you have 15 to 29 pauses or partial pauses per hour in your breathing while you sleep, that's moderate obstructive sleep apnea. If you have 30 or more pauses or partial pauses per hour in your breathing while you sleep, that's severe sleep apnea. It's important to note that, however, that when we look at those numbers, we have to integrate them with a patient's presentation. I see patients who have maybe 9 pauses or partial pauses per hour in breathing while they sleep. But when they are treated, they feel vastly better. So we can't get hung up only on the numbers. I think it's particularly important to talk about why a firefighter would want to know if he or she has obstructive sleep apnea. First of all, even if you weren't a firefighter, you want to know if you have a common sleep disorder that can have such consequences as increasing your risk for crashes, high blood pressure, diabetes, stroke, or heart disease. But think about your service as a firefighter. As it is, you're oftentimes doing shift work, and it's harder to sleep during the day than it is during the night. It's harder to operate safely when you're sleep deprived. So it's even more important to make certain that when you're sleeping, your sleep is of maximal quality. So I would argue that it's tremendously important for firefighters to be aware of whether they have sleep apnea or not, and if they do have it, to address it, because you want to not only get enough sleep, but you want your sleep to be of excellent quality. In addition, you want to be as safe an operator of a fire vehicle as is possible. You don't want to have a syndrome that untreated could increase the likelihood for a motor vehicle crash by a factor of at least 2 or 3 times. Finally, I would argue that as a firefighter, it is important for you to be in optimal physical shape and optimal mental shape. And so you want to take care of a medical problem that might put you at increased risk for things like high blood pressure, heart disease, stroke, and could potentially have negative impact on your memory and your mood. There are a number of ways to treat obstructive sleep apnea. First of all, I'd like to talk about conservative recommendations. If you're overweight or obese, there's little question that losing weight helps sleep apnea. There was a study that showed that if you increased your body mass index by 10%, you made sleep apnea worse by 33%. If you lost 10% of your body mass index, you improved it by 26%. So there are clear data that losing weight makes sleep apnea better. It's important also to minimize alcohol. Alcohol worsens sleep apnea. And even independent of sleep apnea, by the way, alcohol does disturb our sleep architecture. Finally, and absolutely, it's important for patients with sleep apnea to know they must not drive sleepy. There are a number of thoughts patients have for attenuating sleepy driving, but my recommendation is if you're sleepy, let somebody else take the wheel. If you don't have that luxury, you're the only driver, for example, then stop someplace safe, have a caffeinated beverage, and if and only if it's a safe environment, follow the caffeinated beverage with a 20-minute nap. So those are some conservative recommendations, but for patients who have significant apnea, and particularly patients who have apnea where they have comorbidities like diabetes, heart disease, high blood pressure, we need to go beyond those. The most common treatment for sleep apnea is called CPAP. CPAP stands for Continuous Positive Airway Pressure. What is CPAP? CPAP is basically a mask interface that you wear over your nose, sometimes over your mouth and nose, that's attached by a hose to a machine that is nothing more than a very safe, sophisticated pressure blower. The machine is blowing air to safely and effectively open up your airway. Remember, in obstructive sleep apnea, what's happening is your throat is temporarily closing off over and over. So if you can apply a pressure, you can open up the airway safely. That machine can therefore take care of snoring and partial and complete pauses of breathing during sleep. That's our most common treatment. Although some patients don't like the idea of wearing a mask when they sleep, as a physician who's been doing this for over 30 years, I like the treatment. It's safe and effective, and I like safe and effective treatments. The data show that using CPAP lowers blood pressure, protects the cardiovascular system, makes us less sleepy, improves quality of life, and returns the increased risk of car crashes right down to normal. There are other treatments beyond CPAP, however. One other possibility is what we call an oral appliance. It's somewhat similar to a football player's mouth guard, but it's a mouth guard that is made specifically to fit on your upper and lower teeth, and you wear it while you sleep at night. And what it does is it pulls your lower jaw forward and therefore brings your tongue forward and opens up your airway. And these oral appliances are particularly effective for mild to moderate sleep apnea. CPAP is probably better for more severe apnea, although there's some patients who do well with the oral appliance. Some patients really like the oral appliance because it's easy to take on travel, doesn't require electricity. The last of the big three options is surgery. And there are different surgeries for sleep apnea, and I rarely recommend them. I certainly don't recommend them as an initial treatment for apnea in very many patients. I would only consider upper airway surgery, for example, on the soft tissues of the throat or the jaw, after trying and perhaps not succeeding with non-surgical approaches, and after a very frank and thorough discussion with my sleep disorder specialist and my primary care physician.
This machine has changed my life for the better because I'm not tired all the time. When I wake up in the morning, I no longer think, oh my gosh, I can't wait to get home to take a nap, or I can't wait to go to bed tonight, or why am I so tired, even on my days off when I find that I go to bed early. I was trying to get 8 to 10 hours of sleep, and I would wake up and be exhausted, but just not being able to feel completely rested. And one day I woke up and I said, I'm tired of being tired. And I had read something online about sleep apnea, and then I was talking to my mom about it, and she said, oh yeah, grandma had it, and so did my uncle. So I was like, okay, well that was enough for me to go get tested. And since I've had the sleep apnea machine, my husband is very happy, the guys in the bunk room are very happy, and I don't take naps during the day anymore. I'm able to do things with my son. I feel so much more rested, and I think it also gives me better mental health too, being able to feel like I'm able to take care of my family and not be so tired throughout the day. If a fellow firefighter came to me to ask me, you know, what about what is the sleep apnea machine about? How does it work? Does it help, or what have you? Which actually that has happened. I've had more than 2 or 3 people ask me about it. I would tell them, if you think that you're not sleeping well, then you're probably not. If you find yourself being able to sleep at stoplights, fall asleep within minutes of sitting down, falling asleep in doctor's offices, waiting for your appointment, then there's something wrong. And all those things were happening to me. In our job, we're not allowed to have a bad day. Whether it has to do with being on the fire ground, trying to rescue someone or put a fire out, or if it's in the back of the ambulance trying to save someone's life. And if you're tired and exhausted all the time, you're not going to be on your A game. You're going to be exhausted and you're going to miss things. And at the end of the day, who wants to be responsible for that? Thinking that maybe if I would have got checked and got a sleep apnea machine, maybe I would feel better.
Going on CPAP has been an amazing thing for me personally. Before I had it, I was not sleeping well. I would wake up in the morning with headaches, fatigue, irritability. It didn't matter how long I slept at night, 2 hours, 8 hours, 10 hours. I would wake up just as tired as when I went to sleep in the morning, and I couldn't figure it out. So once I got tested and got put on the CPAP machine, it was instantly an improvement. I slept all night. I woke up the next morning, the very first morning after getting the machine, and I actually felt like I had been asleep. And I started to feel like I had not been asleep for years. That's how much difference it made in my life. And physically, I wake up in the mornings now just like it's supposed to, like you've been asleep all night, and it's been absolutely wonderful. That's one of the most amazing aspects of going on CPAP, was starting to dream again. I had not even recognized that I had not had a dream in years. It seemed like, I don't know how long it actually was, but it seemed that long. But once I started to dream again, that was a big part of feeling better. I can't stress enough for anyone who thinks that they may have a problem. If you're not sure, ask your significant other. They'll probably tell you whether or not you need to go get checked out, which was what my case was. And just go and do it, because it makes a huge difference. I can't stress it enough. Please, for your sake, for everyone's sake, just go do it.
I hope you found this segment informative. Again, I'd like to thank Dr. Verona and his staff at Norfolk EVMS Sleep Medicine Center. I'd also like to thank Master Firefighter Debbie Jones and Master Firefighter Mike Wilkinson for sharing their experience with sleep apnea. Please visit evmsmedicalgroup.com for more information. Remember, be safe, be prepared, and look out for one another. I'm Master Firefighter Ned Lowry.